Influenza, or the flu, has several different forms, or strains. Every year, the World Health Organization tracks circulation of influenza worldwide and makes a recommendation to the U.S. Food and Drug Administration to decide which flu vaccine to produce.
But this year, one of the A strains drifted anagenically from the time that they developed the vaccine to the time it hit the U.S., and so there's not as good a match this year. And one of those A strains is the one that's been circulating the most, and it's not the best match, but it's still protecting people at about a 25% level from illness.
I did have a flu shot this year before, so I probably only had it on board for a couple weeks. I got the flu back in December, actually during finals week here at Washington and Lee. It ended up lasting for probably about a week, and I ended up getting on Tamiflu, which definitely helped me get over the symptoms. It was pretty bad for a while.
Even if the influenza strain were correctly predicted, Horton said, 80% of people would have to get the flu vaccine to protect the whole population.
Some people worry that the vaccine can have side effects, that it's actually going to make them sick or give them the flu. That's a myth that's out there. Most people just think, oh, it's not that serious. It's never been a problem before. I'm 18 years old. I've never had the flu, or I've never had something that was serious enough that I would really want to go get a shot to prevent it.
I did not get a flu shot. I always hear it's not that effective. I think this year is like around 20% effective. Had the flu last week. The symptoms lasted about, I think, 4 or 5 days for the most intense ones. I'm actually still suffering from a cough.
Sandra Summer of the Virginia Department of Health gave a statement about the importance of the flu shot this season. Even though it is not a good match, it can still keep the disease from being so severe if you do catch it. The vaccine can also protect against the other viruses that are in the vaccine. Getting it can also protect those around you who are at higher risk of severe disease. Recently, more people have made the argument against vaccinations, not just for the flu, but for more severe sicknesses like the measles.
One study was published suggesting a link between measles vaccine and autism. It was subsequently discredited as fraudulent. I mean, there was actually made-up data that was published. And there have been many other studies that have been published that have shown no link between measles vaccine and autism. So people are choosing not to have their children vaccinated with the required childhood vaccination. That's at a high enough rate in some communities now that their children are getting sick, and then they are exposing the rest of the population.
Health officials suggest getting the flu vaccine and practicing good hygiene to protect yourself and others. For the Rockbridge Report, I'm Kieran McQuilkin.